Can you tell if you have bronchitis or pneumonia? Imagine you're feeling under the weather and wondering if your cough is just a lingering cold or something more serious. Both bronchitis and pneumonia are respiratory infections that can cause similar symptoms, but understanding their differences can help you know when to see a healthcare professional. Bronchitis involves inflammation of the bronchial tubes, which are the airways leading to your lungs. It often begins like a common cold, with a persistent cough that produces mucus. The mucus can be clear, white, yellow, or green. You might experience chest congestion, mild fever, sore throat, or a runny nose. Some people also notice wheezing or a whistling sound when they breathe, and shortness of breath can occur. The cough and bronchitis can last for several weeks as your airways heal. Most cases are caused by viral infections, including the influenza virus, but bacteria or irritants like smoke can also trigger it. Pneumonia, however, is an infection of the lungs themselves, specifically the tiny air sacs called alveoli. These sacs can fill with fluid or pus, making it harder to breathe. Symptoms of pneumonia tend to be more severe. You might experience a high fever, chills, sharp chest pain that worsens with deep breaths or coughing, and difficulty breathing or shortness of breath. Fatigue is common, and the cough often produces yellow or green mucus. Pneumonia can be caused by viruses, bacteria, fungi, or even aspiration of foreign material. People with pneumonia usually feel sicker overall compared to those with bronchitis. To tell them apart, consider the severity of your symptoms. Pneumonia usually causes more intense illness with higher fever, more chest pain, and greater breathing difficulty. The chest pain in pneumonia is often sharp and worsens with deep breaths. The overall feeling of sickness and fatigue tends to be more pronounced. While both conditions can cause cough with mucus, pneumonia symptoms are generally more systemic and severe. Because symptoms can overlap, especially if you have influenza, it is crucial to seek medical evaluation if your symptoms worsen. Signs like difficulty breathing, high fever, chest pain, or a cough that doesn't improve should prompt a visit to your healthcare provider. They can perform a physical exam, listen to your lungs, and may order chest x-rays or other tests to determine whether you have bronchitis or pneumonia. From the perspective of influenza, bronchitis can develop as a complication following the flu, leading to inflammation of the bronchial tubes. Pneumonia can also occur after influenza, especially bacterial pneumonia, which can be more serious and requires prompt treatment. Remember, accurate diagnosis is essential for proper care. In summary, while both bronchitis and pneumonia share some symptoms like cough and mucus production, pneumonia tends to cause more severe illness, chest pain, and breathing problems. Always consult a healthcare professional for an accurate diagnosis and appropriate treatment. If you experience worsening symptoms or difficulty breathing, seek medical attention promptly to ensure you get the care you need.